Erectile dysfunction is the inconsistent ability to achieve or maintain an erection. Erectile dysfunction affects over 30 million men in America.
Erectile dysfunction is a very common medical condition in men. 1 in 4 American men have erectile dysfunction, and that's 30 million men in the United States.
There are many things that may contribute or cause your diagnosis of erectile dysfunction. These include medical conditions such as high blood pressure, high cholesterol, or diabetes. There are also neurologic or vascular conditions such as Parkinson's disease or a history of stroke or perhaps history of a heart attack. There are post-surgical conditions that may contribute to your diagnosis of erectile dysfunction. This may include colon surgery or prostate surgery. And finally, certain medications, use of other substances, and hormonal imbalances may also contribute to a diagnosis of erectile dysfunction. There are several things that we can do in my office to help correctly diagnose your erectile concerns and also offer appropriate treatment options. We may look at your hormonal factors such as testosterone. We may look at diabetic control, blood pressure, and your cardiovascular lipid profile. In addition, in my sexual health clinic, we may perform a penile Doppler ultrasound, which looks at the penile blood vessels, identifying the absolute appropriate therapy and diagnosis for your concerns. I want patients to know that there are several benefits of seeing a specialist for erectile dysfunction. I am fellowship trained, which means that I spent extra time outside of my basic urology training to focus in men and women in sexual health. Also, for erectile dysfunction, I use some advanced diagnostic techniques to help us really identify your specific problem, to help my patients with treatment options that are directed towards their specific problem. We won't waste time on treatments that I don't think work for you. And most importantly, we won't waste money and frustration for you and your partner on things that won't work for you. I also spend time at multiple society meetings and with other erectile dysfunction specialists, not only in the country, but around the world, to see how we may offer you the best in gold standard, advanced healthcare for your medical condition. Those are the benefits of seeing a specialist for erectile dysfunction. Those are the benefits of having a passionate physician advocate for your healthcare needs.
There are several different treatment options for your erectile dysfunction. Oral medications are an option, and there are several brands and types. They are to be taken at different times on various schedules. There are also penile injection therapy, vacuum erection device therapy, and a definitive solution in penile implant surgery. Every man with erectile dysfunction deserves a customized and individualized treatment approach. The way that we decide about the right treatment option for you depends on several factors, including those of your partner. So we may certainly look at hormonal studies, we may look at vascular or other medication options, and together we will decide as a team on the right treatment option for you. There are various percentages to patient and partner satisfaction when it comes to different types of erectile dysfunction treatment. I can tell you that the penile implant surgery has well over 90% patient and partner satisfaction ratings. When I talk to my patients in my practice, I think there are several long-term consequences to not having erections. Aside from just the physical and intimate concerns, I find that it can create a lot of relationship disparity, frustration, and distancing with the patient themselves and of their partners. I also find that men have a terrible problem with confidence when they don't have functional, consistent erections.